Well, I met Bill Vestal, the Crystal Stick King, you know, about 4 years ago at a Renaissance festival, and he showed these to me, and I thought to myself, what a great idea for therapy, because I work with all different kinds of patients. I work with head injury patients, spinal cord injury patients, chronic pain patients, all different types of patients, and I thought to myself, that looks like a fun toy for them to use and get strong with. And the thing that's good about these is that patients are actually doing something that makes them get stronger, but they think it's a toy. So we kind of like fool them into getting stronger, and they don't really know that they're doing it, but they enjoy it, so they like that. I have had a lot of patients recently who've had chronic pain problems where they've had injuries to their feet and they weren't able to actually walk or stand on their foot. And by using these sticks and allowing them to stand and focus their entire being on how to make the sticks work and how to balance them and how to move the sticks in the air, they started forgetting about the pain in their foot and actually started moving and putting weight onto their foot. And this person who I use these sticks with actually went from being in a wheelchair, being unable to walk and put weight on his foot, to moving and walking with a cane now because of the fact that he was using the Crystal Sticks. So that's really great, just to see that someone could have fun with therapy and focus their outside energy away from the pain that they had in their body to the sticks and become a more functional individual. Well, as you can notice, Bill's got a really well-defined musculature system. I mean, you can see as he's doing that right now, see the muscles flexing on the back of his shoulder. Those are all of his deltoid muscles, and they work in tandem. All our muscles in our body do when we don't have any musculoskeletal problems, which obviously Bill doesn't. But his muscles are working in co-contraction patterns. They're working in all different areas of his arm, back, neck, and leg. Right now, you can see his bicep muscles are working, his triceps, all of his trunk musculature, his quadratus lumborum, his abdominal musculature is working, his extensor muscles of his spine to maintain and pull his body back up. As you can see right now, he's stretching and flexing his feet and his knees. So not only is he working his muscles strength-wise, but he's also stretching his musculature in a active fashion, which normally makes muscles stay stretched for a longer period of time. You can see he's doing a real fast job of constantly changing positions of his hands, which helps to increase his endurance for his cardiovascular system. I mean, we haven't even started to talk about that aspect of this, but as anyone who's done sticks can tell you that doing them at this rate and speed for any period of time can get your heart and lungs pumping. And of course, if you were to be really frisky, you could add weights to your arms, weights to your legs. I might not suggest that for someone with knee problems or shoulder problems, but you can certainly make it harder on yourself at any point in time. And of course, Bill has to show off really good now by showing how he can just do it with one hand. The thing that's good about doing it with one hand as well is many people are one-sided dominant, and by stretching and forcing yourself to do it with one hand versus the other helps you to become better at all different sports. One problem that we see in physical therapy quite frequently is people who have had injuries from tennis, racquetball, bowling, any one-sided sport have a lot of overuse injuries and back injuries because of that. And with the sticks themselves, they help you to become more balanced with all your musculature in the front of your body as well as the musculature in the back, and the musculature from side to side, from your left side to your right, which is not something that you see as much when people perform a lot of unilateral or one-sided sports. So I would even suggest this for sports medicine patients, patients who want to get better at the sport that they're performing, whether it be racquetball, tennis, bowling. And you can see how strong Bill's forearms are, which is very important. Also, as far as the newest thing now, a problem that we see with a lot of people who use computers is overuse injuries, which occurs primarily at the wrist and shoulder areas as well as the neck. And you can see by doing all of this, he's strengthening the musculature around that area. And the best way to get rid of a problem is to start by preventing it.